Good morning, everyone. Thank you for joining us on this rainy day, if you're in Maryland at least. I am here with Jackie Tangiers of the Option Group. And just to remind you, my name is Amy Bland. I'm with Phoenix Speech Therapy. So I'm a speech language pathologist working with both seniors and teens. And Jackie's going to tell us a little bit more today, or hopefully a lot more, about all the services that the Option Group provides. What is senior care management? What is senior advocacy? What is placement? All of those different things that are so important for seniors, but also for those of us who have parents that are moving into that area and scene. So go ahead, Jackie.
So we are geriatric care management, but I will say that it's not all geriatrics, because we certainly have people that are different ages. And our goal when we are working with families is to really meet them where they are, and to assess their situation, and their goal becomes our goal as far as, you know, our work together. We try very hard to assess them and to put a plan into place. And you hear the buzzwords all the time out in the industry about aging in place. So we really do try to tailor make our plans when we meet with families and clients, to really find out exactly what they want and then kind of put a plan into place.
And I think that's really important that you share that, because when people are invested in what they're doing, then it's going to work, right? The other thing you brought up is you said you don't just work with seniors. So is there an age range that on average that you've been working with or that you've seen?
I would say on average, most of our clientele are geriatric in nature, but we certainly do have, so I guess I can't really give you, because we even have a lot of younger folks. And by that, I mean, it could be middle school children. So yeah, we've got all different age ranges. And we've got vocational counselors. We have some staff members, nurses that are very, very well trained with like workers' comp. We participate with employee assistance programs. Just to name a few. I don't know that there's anything that we have felt that we had to turn away, but that would be something I would probably have to kind of check into. But we definitely have a very wide range of
it
services.
Sounds like it.
Yeah.
Okay, so with regards to services, what is your role? What's your experience, background experience?
So my background experience, I received my bachelor's in social work, health science and policy and social work at University of Maryland, Baltimore County. And then went on to get my master's in Michigan. And then have worked in a lot of different states, a lot of different things. I've done maternal child health. Social work is one of those fields where there really is a need for social workers in a lot of different fields. But I think the strongest suit was pretty much hospitals everywhere I've worked, which really has helped me in this position to be able to help navigate families, you know, when they have a crisis. You know, we're able to kind of come in, at least understand, you know, about the crisis, you know, whether it's health related or just socially related to their circumstances.
That's a good point, though. Your background helps you have that empathy and understand the circumstances of that. And that's how you and I met in the hospital,
Exactly.
So many years ago.
Yes, I was going to say, and I remember a number of times, you know, going into a patient's room and saying, oh my gosh, like, you know, we definitely need, you know, a speech eval. We need a swallow eval, because we really need to know what we're going to do further, you know, as far as planning for the patients and the family.
And I remember collaborating with you saying, okay, this patient's about to be discharged. We need to set up continued services. So, so it's nice in the sense that different disciplines do collaborate for the benefit of the patient and the family. And I think that that continues outside of the hospital too. And
Absolutely.
And I think that there are a number of people that aren't aware of those resources. So I'm so happy that you're here today to be able to share all of the different things that the Option Group does, because it's not just one service you provide, right? You provide several services.
Right. No, and it's very nice to be here. And thank you so much for inviting us. Yeah, I was going to say, if we really truly, when we have a new referral that comes in, it is evaluated, and I know that Ellen will take time to really figure out like exactly what the needs are going to be, because then she can identify who has the best skill set, to address the clients that are coming in. And
can you share with everyone who Ellen is?
Ellen is the owner of the Option Group. She is very well connected in the community with lots of different organizations, and she is an incredible mentor as far as providing, her staff with direction and her expertise. Yeah.
So when you say you receive a referral, where might that referral come from?
So our referrals, Amy, come from a lot of different places. We have attorneys, speech therapists. We have home health agencies. Employee assistance programs. Just a number of places.
Okay.
We're advertised in the source book, which we find is a really, really good resource for a lot of our clientele. And if you've ever met me before, I always say, don't throw this away, because a lot of our clientele remember what phone books are. A lot of people don't have those anymore, but I always say, keep it with your phone books. And, it might not be helpful right now, but it might be helpful in the future. So I always kind of keep that in mind. But yeah, I was going to say that's one of the, that is definitely one of the resources that, so families might come home, just to finish, families might come home at the holidays or something and meet with mom and dad and kind of say, oh gosh, like mom and dad are not doing as good as we thought they were. So, that kind of starts them on a path to try to find some information that might be helpful to mom and dad. And lo and behold, we may get a call.
Okay.
And they may describe, and sometimes they're struggling and they're having challenges, and sometimes it is a full-blown crisis.
Okay.
So
any of that would be appropriate. Okay. So
absolutely.
As a family member, you can self-refer.
Absolutely.
Okay.
Absolutely.
Okay.
Yeah.
Okay. So they don't need a doctor's order, or they don't need anything like that. Okay. Well, that's good to know.
Right.
And then, after we're finished this, we'll provide Jackie's information for the Option Group with regards to contact information. So if you find that you are in that situation that she was just describing and you're just at a loss as to what to do, then you'll have the contact information to, to discuss further. Maybe is there a way that somebody could just have a phone consultation to see, or what is the process? So let's say I'm that person and I visit a relative I haven't seen in a long time, and I've noticed that they're having a harder time moving around. They're living by themselves, and I'm concerned, both personally and professionally. And maybe I find out that they've fallen a couple times too. So I'm concerned about them living by themselves. I would call your company, and then what happens? Like, can you kind of take us through?
Sure. So the next steps would be that your referral, we do have folks answering the phones and taking referrals. So you would be met with a live human being, which is nice.
That's huge.
And I would say it is huge. And I would say that 9 times out of 10, the phone would be answered by someone. If it is after business hours, it may go to voicemail, but just know that your call would definitely be returned. But you would be able to explain your circumstances. You would be able to give detailed information about your relative, and that could take especially if it's crisis, it could take a little time to kind of get, an idea of exactly what direction. After you have provided that referral, then Ellen would give you a call back, and she would discuss the circumstances with you. A lot of times an appointment may be set up to meet with you individually, depending on your circumstances. Sometimes the families just want to meet individually first. Sometimes they want, no, I want you to see, Uncle Frank.
So it's case specific.
It is very, very case specific.
That's good. Okay. So then once that happens, perhaps a plan is put in place, right, at that point. Okay. So I'm thinking it's more like a navigation, right? You're navigating or guiding people into, these are some options for you that would work.
So after we do that initial assessment, we will do some research to really fine tune the services that we think will be the most beneficial. With the platform that we work from is safety.
Okay. Well, that makes sense, right?
And we try very hard to, although it might not be what patients and families want to hear, we will be very honest with what our suggestions and recommendations are. So safety is a big, huge factor. And I would say sustainability is another really, really important thing, because no one wants to move 4 times. No one wants to be uprooted, from their home. So we focus, if someone really wants to age in place, we will come in, we can do home evals, we can make suggestions. If it seems that an alternate placement is needed, we will make the recommendations. We will do some research with facilities and try to get like a little bit of a cost benefit analysis.
Okay.
So that you get an idea, like, so if you're going to stay home and you're going to have 24-hour care at home, this is what you're looking at. We try to give them very up-to-date information so that they can make informed decisions based on that information.
Right. And I think that's important, because at the end of the day, a lot of that isn't, that's the stopping point for some people, right?
Right.
So just to be clear, aging in place means that the person stays in their house, but they may need care, whether it's, we call them ADLs, or activities of daily living. And what that means are things that all of us really take for granted that we do all the time.
Right.
So, going to the bathroom, taking a shower, cooking yourself a meal, moving from one room to another room, getting dressed, all of those things, as high as balancing your checkbook and paying your bills and taking your medications correctly on time and the right dosage and so forth. So, and of course, fall risk always plays into it too. Right. So 24-hour care could be like companionship, right? Or it could be people doing all of those tasks that I just mentioned.
Right. And that was definitely, I couldn't have said it better myself, is that the agencies that provide the care are not part of our agency, but yet they are a lot of times tried and true agencies that we have worked with, over the years, and, that we find we have really good response. They will communicate with us. If they're folks that are in there are sometimes the boots on the ground that are seeing the everyday ongoings, and they will communicate with us if they are suspicious that someone is a little unsteady or might need some additional assistance. One of the other areas that we can assist with, we also do cognitive assessments. The assessment that we use is called a BCAT. It's a brief cognitive. Are you familiar with that?
Yes, I give that too.
Oh, okay, okay. So we're able to do that as well. So there may be, sometimes it's really helpful to do that and have a baseline of the patients and clients that we're seeing. But back to the aging in place, it could be that they're already in a facility. They could be in a CCRC, the continuing care retirement community, where they're in the independent, and they're fearful. They don't want to move to the assisted living part, even though it's available to them. So sometimes the aging in place can really be like where they are, and trying to really support them and add services to them so that that they are safe and that they're sustained in their environment.
That makes sense. So you mentioned moving from independent to assisted living, right? So how does that work in the sense of when or who makes that decision as to, okay, things are changing with your health, whether it's physically or cognitively or combination, and due to fall risk or safety risk or whatever,
right?
We feel that you would benefit from going to the next level of assisted living. Who makes that decision? Is that something where the family makes the decision? The family has to go to the doctors, the facility? And I'm asking because I truly don't know.
Well, it's a very, that's like $1 million question, because I don't think there is, I think it's a very much a collaborative effort. That there's enough information out there from, you know, the patient, client, relative that has driven the family, you know, to make a call, whether it's to the doctor, whether it's to, you know, the option group, you know, and as a clinician, I think it's very much a collaborative, you know, that if the word's out there on the table, I think then we all try to pick it up from our own lenses, and we, you know, can all add some information to help create, you know, what we think would be the best plan.
That makes sense. So really anybody,
right.
Just like the referral piece, anybody can say something. Okay, well that's good to know, because because I know there are different eligibilities for different things, different criteria. So, and I'm sure different facilities say this qualifies you for this versus a different facility, maybe.
Exactly.
Okay, very good. Let's see, what have we not covered?
I don't know. Have we? What have we not covered?
maybe the payment situation. So how does that work? If I wanted to refer someone to your group, is it out of pocket? Is it insurance? How does that work?
So we are private geriatric care management. We would gather a retainer fee. And that retainer would basically be held and put towards your last invoice, depending on, and it really depends on how much assistance. We have had clients that have been on service for years, maybe as long as Ellen has, you know, opened the option group.
Right?
Exactly. And some where it's a, you know, sometimes it's a one-shot deal that they really need direction. They need that, you know, come in, figure something out, put things into place, and then they're like, okay, we're good now. So we are on a retainer fee, and then we are billed out hourly.
So it's similar to an attorney, really.
Similar,
right?
Yes.
Okay, well that's good to know, because I know that's on everyone's minds, right? Okay, good. Are there other services you had talked about? You have nurses. Who makes up the option group? That's what I should have asked in the beginning.
So obviously Ellen at the top, the helm of our ship. And then we have Michelle, who is our office manager / guru of everything. She maintains, kind of keeps everybody going and knows what direction. We have another Michelle. We have two Michelles in our office, not to be confusing, and both are absolutely wonderful to work with. We have Stacy, who is our nurse. And we also have Katie, who is a nurse who's very versed in workers' comp and very intricate type of clients and cases. We have, I'm trying to think, we have Dee Dee, who just joined us. So Stacy, Katie, and Dee Dee are our nurses. We have Samantha and Lynn. Another thing, actually, just one of our employees was just out on maternity leave, but so we're excited that she's coming back. But we have an engagement program that we find that some of our elderly clients, specifically our clients that may be challenged with cognitive impairment, that engagement is really important in any walk of life, but specifically when they have lost their own ability to decide what they want to do and they require some direction. It's very, very nice service that we offer is our, I'm not even sure exactly what her title is.
Okay.
But honestly, Lynn meets with our clients, and she has lots of different activities that she can do with the clients.
That's great.
Like in their own homes, wherever, wherever it seems to work best. Things, she tries to really capitalize with the family on, what did they do in their, younger working years and their interests, hobbies. And she comes up with some really nice activities that really help to engage them and get them, exactly, get them, definitely stimulated. Yeah.
Good. And so that sounds like that would fall under people that have mild cognitive impairments, maybe even some moderate, I guess, depending on.
Exactly.
Okay. And so that's called the engagement
program.
Yeah. Okay. Good. And then of course yourself. You're part of that.
Here I am. Yes, I'm the social worker. Right.
Good. So as you found out today, the Option Group has plenty of different services with different roles and disciplines. Tell me a little bit about what the nurses do. So they come out to the house. Is that what their role is, to kind of give a physical evaluation? Is that what they're doing? Or?
I think, well, all of us will, like if we go out to someone's home, we will, in addition to doing the assessment with the client and the family, we will also walk the house gingerly, and really just eye different things. Obviously, if we see something, we will say something and we will put it in a report. We definitely would make recommendations. Certainly, once again, at the top of, the list is the safety issues to make sure. And I know there are trained therapists out there that would go out and do a home eval, and we all know about scatter carpets when you have a tripping, hazard. But in addition to that, we may, if we see, outlets, that look like, the cover's off, and just little things we try. If we see something, we will definitely say something.
Well, that's important.
Right.
So you said you write a report. Where does the report go?
So the report, after it's written, would go to the referral. If you were the one calling us, we would give you an idea of, after we've gathered our resources, we want to make sure that the information we're giving you is tangible and that it is, up to date, and, that the referral and the resources that we're giving you are things that you can actually, pick up the phone, make a call, or you can say, hey, you know what, I like this idea. I really think we need to get private home care in here, even a couple of hours, each day, or a couple of hours each week, just to kind of keep an eye on things. So, we're glad to make those calls for you and meet with you, put that into place. We will definitely fine tune what the skills are and what the needs are for the client, and what the care provider will do. We know they're not going to come in and do deep cleaning, but we know that they can help to keep the environment neat and tidy and clean. They can assist with meal preparation and things like that. So we will make sure that from A to Z, what to expect, and the responsibilities of each person.
Okay. Well, that sounds really good. So depending on what your needs are is where you meet them, right? That's what you said. So it could be a plethora of things.
Yeah.
Certainly feel free to post some comments or ask us any questions. I see my Aunt Fran is on. Hi, Aunt Franny. Thank you for joining us. So the nice thing about this video is that you can replay it at your convenience. You can also post as many questions as you'd like, and Jackie and I will answer them to the best of our knowledge. I can certainly answer the speech questions. Jackie's going to answer all of the placement, senior care, senior management questions. Cognitively, we share a little bit. So
yeah, I was going to say, I wanted to know like a little bit more because I know this is
about what I do.
Yes, this is very exciting.
Right.
Yeah.
So Jackie had mentioned the BCAT, which is the Brief Cognitive Assessment Tool. It is excellent in the sense that it is a well-researched screener that really does the best job that I've seen so far of looking at people that have mild cognitive impairment, or MCI. And this is a relatively newer term. For a long time, there were people that were starting to have changes in their cognitive skills, whether that was attention or memory or problem solving. A lot of times it's memory. And they were almost how do I say it? They were almost falling through the cracks.
Right.
Because it was, okay, either you are functioning as a typically aging adult or you have dementia. But there's a large spectrum in between. And so the BCAT helps to pick up some of those areas of where people are having a little bit of difficulty. So I do like the BCAT.
Right.
I will go a little bit further just because of my background. So I like using it as a screener, but if I see on that screener that somebody is having, the number one thing that I see is difficulty with remembering new information.
Okay.
So Jackie may say to them, Mr. Jones, I just want to remind you that you have a doctor's appointment in 2 days at 12 o'clock. For whatever reason, that information is not sticking. So that's just one example of new information. Another example might be that so-and-so is visiting them later this week, or even that maybe somebody from the option group is coming over to meet with them. They may say, I don't remember that, and who are you? And that can cause some confusion and anxiety. So what I found is that with the BCAT, it will give me an idea as to where the areas are. And if it's memory, almost always attention plays a role too, because you can't remember something new if you're not attending or concentrating on it. Right. So then I will take it a step further and really look at and assess. There's about 4 different levels of attention that we regularly use. And so I will look at those levels of attention first, and then I will assess their memory. And of course, there's so many different levels of memory. I could do a whole other tangent on memory, but I find that it's really helpful for people that fall into that MCI category. Speech therapy is really helpful because they're not at a place where it's really difficult and challenging. They're still at a place where they can be challenged and they can start to learn new skills. They can make new pathways in their brains to get to that information a little bit easier. The other thing that I teach, and I'm sure that you do this too, are using compensatory strategies like a planner, a calendar. Phones are great now. There's timers, there's alerts, the medication, the pill boxes. Now they have sound
that are interactive,
timers.
Right.
They have locks on them. There's so many things assistive technology that can be used. Google, right?
Yeah.
Siri.
Yeah.
So,
Alexa.
Right. So all of the things that we use for fun really can be very helpful in a therapeutic sense. So those are some of the things that I do. So with regards to cognition, we both are using similar screening tools. I guess, for me, I take it a little bit further just because of my background. That's something that I treat and evaluate. With regards to dementia, because I think we need to touch on this too. From a speech standpoint, for dementia, the best research out there says, as a clinician, for me to come in, assess the person's skills, strengths, and so forth. And again, dementia has many different faces, and there's different types of dementia. It's not just Alzheimer's. There's vascular dementia, there's Lewy body, there's dementia associated with Parkinson's. So there's many different reasons. But what I tend to do is go and evaluate that person, but also evaluate what is their typical routine, what are they doing, and try and help the caregivers modify the environment so that it's less scary for that person, and to promote the best communication.
Mm-hmm.
However, I'm not in there that long.
Mm-hmm.
Because most of my clients have Medicare, and Medicare will support that I'm in there for a little bit to help, but the research just doesn't show a lot of improvement
Mm-hmm.
with a dementia diagnosis. That being said, that's probably where your services are really important.
Right, because when we come in, and just like Amy said, the different phases of dementia are very vast and wide.
Mm-hmm.
And I think being able to, meet someone, and not only do you see the results on the BCAT on a piece of paper, but
Mm-hmm.
what I like is to be able to see the person and really see like what their presentation is, and things like making sure that their medications are given properly is, obviously part of what we do as well, trying to put that plan into place. But our goal is really to try to make each person be the best version of themselves, mm-hmm. given their circumstances. Mm-hmm. I've seen so many clients that, may be at home by themselves, not really eating very well,
mm-hmm.
not really drinking fluids, really lack in hydration, and have one presentation. But once you get those things into place and they get that on a regular basis, it's amazing
to see a new person, right?
You see a new person, and you see them bloom, and then you get engagement, activities mm-hmm. in there, and it really is exciting. It really mm-hmm. is to see them flourish and really be the best version of themselves. Mm-hmm. Yeah.
So I guess depending on, like you said, case specific, right? So
right.
some people have the ability to have the caregivers coming into their home.
Right.
And with dementia, the more familiar, the better. So
right.
that's the ideal situation, to keep them in their home where they know where everything is. Mm-hmm. But I'm sure there's times where maybe there's just not family or support mm-hmm. to stay in the home. And then there's other options, right?
Right. There are other options out there. There are so many different, and our resources out there. Sometimes adult day health, might be a really good option, just simply because we know they have a medical component. They're able to assist with mm-hmm. speech. They're able mm-hmm. to assist with PT and OT, mm-hmm. physical therapy, occupational therapy evals. They're able to work on medication management.
Right.
Some even will give baths, if your loved one, has a difficult time with that, they mm-hmm. may assist with things like that. So once again, we always come back to, that tailor make mm-hmm. and making sure that it's the right fit and that it's the right services. And sometimes things work, and sometimes we find, maybe let's take another look and maybe take it a step further. Right. So we definitely do placements, and I will just add this in here because I think it's an important thing, and I am certainly not saying anything negative about some services, but I think it's important to know that we are not being paid by facilities to bring someone to the table. Mm-hmm. And I think that, once again, we just like to, really emphasize that, when we tailor make something, a plan, it really is very much,
it's for that person's needs. Period.
Right.
Yeah.
Right.
Well, that's good to know, because
you will. You'll meet some folks that are going to be reimbursed by a facility to bring you in there, and I think there are facilities that are correct for a client, and then there are some facilities that are not correct.
Right.
So it's just important to know that we are certified in geriatric care management.
Okay.
And just like Amy,
mm-hmm.
with the BCAT, we had to be certified in being able to administer mm-hmm. that as well.
So would you say it's a good idea for people to take tours of facilities if they're interested? How would you help somebody navigate that? Someone said to me yesterday, they refer to it as looking like you were looking for colleges. Mm-hmm. They're all different. Mm-hmm. Some are bigger, mm-hmm. some are smaller.
Right.
They have different pay levels, I would assume. They have different levels of care.
Right.
And I guess also probably different living situations, right? So mm-hmm. some are more like a condo, and others are more like, what would I call them? Like little villas.
Mm-hmm. Mm-hmm. I would definitely agree. It really is like trying to search out colleges, because you're absolutely right. Some folks, just like if you like to live in a big city with a lot of people, or just like you are the,
more the homebody
country mouse,
right?
right? That you like your space and, only a couple of people around. So, yeah, we definitely take a look at that. And there are facilities out there. There are folks that have their own individual houses that they have become licensed, for
like smaller
for assisted,
facilities.
yes,
Okay.
for assisted livings. So there is something out there for everyone, believe it or not.
Well,
there
that's
really
good.
is.
That's
Yeah.
good to know, because I think this whole process can be very overwhelming. I recently worked with a family in crisis.
Mm-hmm.
Right after the hospital, they were discharged,
Okay.
and thankfully, speech was their least, need.
Okay.
But they had other needs physically and so forth. And it was overwhelming for this family.
Mhm.
It was a situation after a stroke, and as most of us know, strokes are unpredictable. So it's not something you can plan for.
Right.
And the other thing with strokes is you have no idea how that stroke is going to
Mhm.
impact you. It could be very mild or it could be devastating.
Mm-hmm.
So, so anyway, it was very overwhelming for this family, and they said just the emotional
Mm-hmm.
component of why did this happen? Why is this happening to me?
Right.
Am I doing the right
Right.
thing? All of those
Right.
questions too.
Right.
So it's absolutely normal, I guess is what I'm trying to say, to feel overwhelmed,
Mhm.
but people like Jackie and the Option Group are here to help and provide those resources, so that if it is feeling overwhelming and you're getting to the point where you just don't know what to do, I think that your group is excellent in the sense of talking someone through it
Mm-hmm.
and just validating, yeah, this is really a tough time,
Mm-hmm.
but we're going to take it step by step and,
Mhm.
and help you out.
Mm-hmm.
So,
Exactly. And we really do try to find out what your challenges are,
mhm.
and how you describe them. Because we might see something else, but we also equally, I think, is important is we try to identify what your strengths are,
Mhm.
and we try to capitalize on, what those strengths are. Sometimes your family support is what the strength is.
Mhm.
It could be, your prior history, like what you did, and that there are lots of things, but we do try to really focus on that
That's
as
good.
well.
That's good.
Mhm.
So we are going to wrap it up unless you have anything else you wanted to share.
I can't think of it. I think we've talked about an awful lot. I know there's other things. I'm amazed every day that it could be something different. It's
Mhm.
never the same. Things might seem the same, like we might be doing research on each client, but the research we're doing for each client is different.
Each
Because
person's
everyone's
different,
yeah,
right?
exactly.
So I guess what I'd like you to share, and I'll write it as well, but if you
Mhm.
could share some contact information
Oh,
for
absolutely.
people.
Okay. So to reach the Option Group, the best is to, the phone is 410-667-0266. And you can also go on the internet, and you could Google the Option Group,
Okay.
and that you will get that information. And that is a really good way to learn a little bit more as well.
Okay.
There are blogs on there. There are resources. One of the other things just came to mind that we can offer as well is like a virtual dementia tour, that we have the resources, which is unbelievable.
Mhm.
It depends on your environment, and it depends on what your needs are. Sometimes it might be good for like an assisted living staff, or it might be good for,
Okay.
but it's something that if you're ever interested, that would be something as well.
Okay.
Yeah.
So I just tried to type it, but it won't let me type while we're
Oh.
recording. So right after this, I will type all of her information that she just shared so that it's in print and you can see it. The website sounds like it has the most information written, right,
Absolutely.
where somebody can look at.
Mhm, mhm.
But I believe also if you're in LinkedIn, I believe you guys are on
Right.
LinkedIn.
Yes.
And I'm sure there's other social media
Mhm.
that you're probably part of too with regards to Facebook. So if you have any questions or comments, please feel free to put them on this site with this thread. And like I said, you can replay this whenever. So even if it's a week or a month later, that's fine. You can post something and we will definitely respond back to you. So thanks for joining us today. I hope that this was helpful and that maybe you learned just a little something that may be helpful either now or in the future, either for yourself or a loved one. So have a wonderful Tuesday.
Thanks.
Thank you, Jackie.
Thanks, Amy. That was really nice. Thank you so much.
Sure.